Well, good morning, everyone. I'm Dr. D.K. Miller. I'm the Executive Director for Carolina Collaborative Community Care. And I am so excited this morning to have with me Christina McCraw. She is our Case Management Supervisor for our Carolina Complete program. She is an RN, a CCM certified nurse, and she really does a lot of great work with the program. And as we talk about the things that we're doing at Carolina Collaborative Community Care, I think it's important that we highlight the work that our nurses perform because a lot of times that work goes kind of behind the scenes. People don't understand what you all do. I think it's important to talk about what you guys do as care managers, how you're healthcare extenders, but also how you guys work very diligently to keep patients, from having to go back to the hospital or be readmitted or back to the emergency room and things of that nature. I'll let you go ahead and get started and kind of walk us through what you all do with that program.
Okay. So we are a case management entity. So we provide solely case management services for as far as Carolina Complete Health goes, it's based on your regions. So the regions that we cover and we partner with Carolina Complete Health is we cover 6 counties. So, kind of split those up. And so the counties that we cover are Cumberland County, Harnett, Hoke, Moore, Robeson, and Sampson. So those are our catchment areas. Right now in those catchment areas, there's approximately, 9,000-ish, give or take, patients. Of course, it depends, people roll on, roll off. So that's about our population right now that we work with. So with case management, as far as kind of understanding what that is, so it's a specialty practice within not just the health and human service professions,
Mhm.
but also with nursing. So, but we also partner with social workers, licensed clinical social workers. We'll partner with pharmacists, doctors, or anything like that. So it's a specialty subset in the healthcare world. And the premise behind case management is that everyone will benefit when our patients, our members, our clients can reach their optimal level of wholeness, of wellness, being able to self-manage their care and their functional capability. So when you can meet all of those things, more positive things happen. And so the purpose of case management is to kind of help members identify what needs there are. Based on those needs, we're trying to help ensure they have appropriate access to maybe different resources they need in the community, different services or treatment areas that they may need. We help try to facilitate safe care transitions if they've gone into the hospital or the emergency room. We help them transition safely back home or to their next area. But overall, we're trying to help them meet goals. We're trying to advocate for them and, help them become as self-sufficient as possible.
There's so much that you were talking about that you guys
Yeah.
are doing, and it is a lot of work, and I know that it keeps your team very, very busy. Talk to us a little bit about the age ranges of the patients that we
Mhm.
often have to interact with. Could you
Okay.
share a little bit more
Yeah.
with us about that?
Certainly. So post-Medicaid transformation, the structure is a little bit different and set up within the state. So for us, we'll manage anywhere from typically 0, so birth, up to approximately 65 years old. And so that's typically when you'll see patients transition to dual Medicaid and
Mhm.
Medicare. So our age range is typically around the 0 to 65 years of age. We do slightly have, when you're in our smaller population, our younger population. So maybe anywhere between 0 to 20. And then when you get back up to 55 and 60 above, the population is pretty even when it comes to male versus female. And then, but
Mhm.
in our middle range, where we've got like our 21 to 55-ish year olds, it actually makes a drastic change. And we do have more patients who are female versus male.
Mhm. Yeah.
And of course, though, you have to think a lot of obstetrics, pregnancy
Yeah.
related
Yes.
things. And so Yeah, you'll see a fluctuation, but for our age ranges, it's 0 to approximately 65.
So then we really do cover the entire spectrum of ages, where there's small children, infants, newborns, and even on to the middle age and older adults. And I know that, we have other programs that have been more focused on mothers and babies, but we obviously get a chance to interact with mothers and babies in this program also, as you
Right.
all are trying to help meet patients' needs. Let's talk about some of the need that the care managers help patients to meet, and some of the problems and challenges that you guys assist patients with as you work with them through their various situations.
Yeah. So some of like the, just the more simple things that we can help with is basically we can listen to them if they have an
Mhm.
issue or a question or concern. So the simple one is listening to them and answering any of their questions. A lot of our patients sometimes will come out of the hospital with a new diagnosis. So maybe they've been in the
Mhm.
hospital for fluctuating blood sugars and they've been diagnosed, whether it's, they're in the age range to be diagnosed with type 1 diabetes, or if they're in an older age range and it's type 2, sometimes they'll come
Mhm.
out. They do get education in the hospital, but being in the hospital is very overwhelming. You only absorb so much
Mhm.
information. And then when you get
Certainly.
home, most people are like, oh my goodness, what did they say? So we
Yes.
can help
Yes.
them take that bit of information in smaller chunks and provide education over short periods of time to help them better retain it. We will also set what we call care plan goals or goals, self-management goals with the members to where we'll take these little baby steps. So if their overall goal is to maximize their health so they can go fishing with their buddies, but they've been having
Mhm.
problems with their blood sugar, then what we do with them is we help make it smaller. So if your overarching goal is to go fishing, then what are the things that we need to do to keep you healthy, get you healthy? And then we create these goals and then the little baby steps that take you to get there. We don't want to make anything overwhelming because sometimes if we don't hit those goals right away, it's hard when you feel like you failed or you're not quite hitting it when you're supposed to. And everybody moves differently and at different paces. So we try to meet the member where they are and help them get to where
Mhm.
they want to be. So just the simple first one of listening and just helping them answer their questions. And then, as I kind of mentioned, is teaching them about their health conditions, whether it's a medical health condition, a behavioral health condition. It could even be something that's acute, meaning it's short term, such
Mhm.
as if you have a cold is short
Yeah.
term. Or if you
Sure.
have a chronic condition like diabetes, which is typically lifelong. So, teaching them and educating them, helping them learn ways to take care of themselves independently, because your ultimate goal as well is you want the patient to be able to do as much as possible independently because they're the ones that take care of themselves. Some people don't have a huge support system, so they've got to learn to
Certainly.
do, certain things. So that can be another barrier is when patients don't have a large support system. They have a smaller support system or they don't really have a support system. So we can be their support system and help them become as independent as possible. Different things, even like helping them coordinate their appointments, helping them coordinate transportation. Carolina Complete Health partners with a transportation company that will help take the patients to their appointments, to their lab work, if they have to go pick up their medications from this pharmacy, anything medical, behavioral health
Sure.
related. It's a service
Sure.
that's offered for free to help the patients get to, where they need to go. Because sometimes transportation is another barrier, talking about things we can do and barriers. Sometimes people don't have their own mode of transportation, or sometimes are trying to rely on family members or friends. And, people have things come up. So having that one solid, reliable mode is always helpful. And we can set up just singular trips, or if a member has dialysis that they have to go to 3 days a week, we can set them up on reoccurring trips so they don't have to worry about, calling in time and scheduling. So that's another way to help with some barriers as well. Also, medications. I mentioned pharmacies. We're there to help what we call do a medication reconciliation, to where we will take whatever list we have, whether it's from the hospital, if it's a list that we have based on claims in the system, a pharmacy or a provider, and then we sit down and we actually go through these medications with the member to determine, are they taking these medications? Are they taking them as prescribed? And if not, what is the barrier? Is it that maybe they didn't quite understand? Maybe it's not making them feel very well. And so we need to maybe call and try something different. So we're there to help answer questions about meds as well, not only just conditions, but the medications they're taking, how to take it, safe way of proper disposal. So even down to, that information. And then also another big one is connecting them to resources. If our patients have what we call social determinants of health, which means they may have food insecurities, housing insecurities, there also may be some interpersonal violence or transportation. There's a different array of social determinants of health outside of just their medical and behavioral health conditions. So we try to connect them with any helpful resources or support that they might need from the community to help fulfill and fill in those gaps of care.
That is really wonderful. And I'm so glad you mentioned the issue of the social determinants of health. I know that's gotten a lot of publicity here lately, because there are many patients that are impacted by these social determinants of health. And I think it was very helpful, and it was great to hear how the care managers are able to connect patients with resources. As you think about people who face food insecurity and or housing insecurity or interpersonal violence, what are some of the approaches that your folks have used in the past, the care managers have, to kind of help patients along with those issues, help them get to a better place, or help them get to a different space so they can feel safer, or have some of their needs met?
Right.
Christina.
So we definitely, every time we speak to a member, we do a assessment on their social determinants of health to determine what it is that they may need assistance with, or if they have an insecurity in a certain topic or area. And the reason for that, kind of explaining that as well, is until the patient's social determinants of health are met, it's going to be really hard based on research and data. It's going to be harder for a member to meet their goals for their health conditions, their behavioral health conditions. Yes. Because if somebody is worried about putting food on their table, or feeding their children, or keeping their electricity on, that comes first. That's a priority compared to, am I taking my medications like I'm supposed to, or if I can afford my medications, or if I'm taking my blood pressure, blood sugar. So making sure you're really ensuring that everybody, their patients, your members, your clients, those social determinants of health are met, because then they're more likely able to remove the focus on that and then actually start taking care of their conditions, their behavioral health, medical things. So we do an assessment on all of the members that we come in contact with to determine if they have any of those insecurities or areas that they need assistance with. And then once we flag, per se, one of those, then we're able to hone in and see, okay, based on their region, their county, their area, what do they qualify for? So we have a list of community resources that may be available to them. Some of them, we know right off the bat, yes, go here, take care of this. Sometimes it's, takes a little bit of calling around to see, depending on the need. But if patients have, let's say, for example, food insecurities, we can rely them not only to local food banks, Meals on Wheels. There's also a program within Carolina Complete Health. It's called a value added service. So it's a additional benefit to the member, to where for a 6-month period of time, if they have a food insecurity, for 6 months, they'll receive a kind of like a preloaded debit card, per se, to where they'll get so much monies per month for 6 months to help them kind of get on their feet through
Sure.
this specific insecurity. So there are some value-added services around food insecurities. There are some community entities that are able to help with food insecurities to help get the members back on their feet. If we feel like they may qualify for SNAP benefits or EBT benefits, we'll sit down and explain to them what those are, how to apply, and definitely apply even if they don't think they'll meet the criteria, because you never know. And that's another way for them to get some added monies to help with the food insecurities. If they have housing insecurities, kind of the same premise. We know certain areas in the counties, we know kind of the criteria. So based on the patient's background and history, we'll kind of know
Mhm.
that the patient can go to certain areas and fill out applications. There's also the continuum of care in certain counties where they can help them get into housing, transitional housing. There's specific housing for members who have behavioral health conditions, substance use conditions. So trying to figure out what it is that would best benefit the patient and the criteria that they meet.
It's amazing the number of services that you refer to. I think it is. I think a lot of people just don't have the knowledge that these services are available to them. And I think what you're saying now is that that they do have resources. I'm sure that's going to be very helpful. Generally speaking, as it relates to patients getting in contact with the care manager or care management services, is that going to normally go through their primary care physician? Generally speaking, if they need to have that referral.
Yeah, and they don't even have to have a formal referral. So if they notice, if they have Carolina Complete Health and that's the insurance and Medicaid card that they have, then they can call the number on the back to member services, and the member services will let them know that they're interested, if they need assistance and they need help. But they can certainly ask their doctor, and the doctor can, inform us. Like I said, they can call member services, and member
Hmm.
service will get us referred over. So there's different ways. They can also go online to Carolina Complete Health, and there's a portal. Each member is able to sign up for their own portal that kind of helps them manage their care. They can go in and see information from their claims and different things. If they need to fill out a specific form for Carolina Complete Health, that they can. For example, in the pregnancy program and the pregnancy parents that we cover, there is a value added services that allows assistance to receive
Hmm.
either a car seat, um, diapers, or breast
Okay.
pump. And they have to fill out a specific form though. So like, for example, that form they can go into their portal and fill out. But yeah, they can go in there, they can request services themselves, or they can request services through their provider. But mostly it's usually simple and easy if they just call that number on the back of their card, and then they'll reach out and let us
Good.
know.
Wow, it's amazing how, as you talk about, it's simple enough just to reach out, but I know a lot of times people may have apprehension or maybe,
Right.
maybe a little concerned or whatever. But I think to your point, you are there to help folks and to help them get to a better place, maintain their health, or to help them to reclaim their health if those things have happened. One of the other pieces that I like to talk about, and I'll put this plug in there for 4C. If you're listening to this and you're not a member of Carolina Complete, and if you think you might need services, have your physician to reach out to our practice, and we can certainly talk with you about if there's a way that we can potentially help you. But we do want to try to help folks who we are able to help, but there are some restrictions that we have, but we wouldn't know for sure until we reach out and give it a try. So if you feel you need some help, we'll put information on the screen here for you to be able to talk with us, reach out to us, so we can try to see if we can assist you. I'd like to do one thing for me, if you don't mind, Christina. I think
Mhm.
you talked about things very generally about the services and the programs, the care managers who I think are doing a great job. Could you give us a little bit of a snippet of a story about a patient you guys were actually able to help who was in need, and you guys were able to help that patient to meet their needs?
Oh, yeah, there's definitely plenty of them. The more recent one I can think of is we did have a member that had a social determinant of health of interpersonal violence, and she actually resided in a separate county. So that county kind of started the process of helping her get away from that situation, and they sent her to Cumberland County. So once she was in our county, that we were able to get her set up in a hotel, and we've been working with her into getting into transitional housing. We've been able to get her connected to motive care, so she can now utilize motive care. We've gotten her set up with new doctors because where she came here, she wasn't connected with anybody. So we were able to get her connected with primary care physicians and specialty doctors, not only for herself, but for her children. So she's able to
Wow.
utilize and rely on motive care to get to those appointments and kind of get back on track with their health care, because they had some kind of, each of them had some health conditions, and trying to get back on track with that, being able to pick up their medications and everything like that, and then get connected with a community resource that's being able to help them find transitional care, transitional housing, excuse me, in order to get her from the hotel into a home. So that's just a small example of a specific kind of patient where we've been able to help depending on their social determinants of health.
That is really wonderful. And I think it's so exciting to hear how you're really making a difference in the lives of the members of the community, how you're taking people who really need help and getting them help. And to your point, sometimes folks think their situation may be hopeless or helpless, not recognize that there are resources and people who can help them. I am so appreciative and thankful for the work that you and your team are doing to help those Carolina Complete patients, but I think also to help our community in general to be healthier and to be more aware of the needs, programs that can help them if they have particular needs. I just want to say we truly appreciate the work that you do. We thank you for everything you and your care managers do. Your work is not in vain and is very, very much appreciated. Do you have any closing thoughts that you'd like to share before we wrap things up?
No, I mean, I think we've talked about a lot today, but yeah, our goal overall is to, meet patients, members, clients where they are, help them to get to their goals, whatever it may be, and go in baby steps, to help them know that they can do it, they can get there. Sometimes it's not easy, sometimes it's hard to do it, but, helping them take care and take control of their lives, like you said, to live hopefully better, healthier lives and enjoy the time that they have here. But yeah, we're here to help however we need to, however we can. Of course, we all have limitations. We have, we're not, though we feel like,
Yeah.
we're not superheroes and have the answer to everything, but we will try our best to help connect people with what they need, where they need it, how they need it. But yeah, we're here to help answer questions and yeah, just take care of everybody that we come in contact with.
Listen, I'm so thankful and grateful for what you've done and all the things you've shared with us today. I think has enlightened me a lot more about the work that the care managers are doing. And I think it's a true reflection of the love and care that you guys have for our patients and for the community in general. I'm so appreciative of the work that you're doing. And I look forward to us talking some more in the future about some other things that we're doing here at 4C. Please continue to keep the good work up. And I just leave everyone with this thought. If you're interested in care management services and you want to reach out to us, by all means, we'll have our contact information on the screen. We thank Christina and her team for what they're doing. Bravo.
Thank you. Thank you.
Bravo. We thank you so much. And listen, you have a great day and a great week. And I'm sure we'll be talking a little bit later. Take care.
Sounds good. Thanks for
We'll
having
see you
me.
next time. No problem. Take care. All righty. Okay. All right. Bye-bye.
All right, I'm going to stop our recording.